Let me guess what happened. You went in for a routine blood test. A few days later, you got a call, or you logged into a portal, and there it was, a number next to the word creatinine, and it was higher than the range printed beside it. Maybe your doctor used the words reduced kidney function. Maybe they said GFR. Maybe they even said chronic kidney disease, and that phrase landed in your chest like a stone. And then what? You probably nodded politely, took your paperwork, went home, and spent the next several nights on your phone, searching those exact words at 11 p.m., reading forum posts written by strangers, getting more scared instead of more informed. If that's you right now, I want you to hear this clearly. You are not alone, and you are not out of options. Elevated creatinine is one of the single most common lab findings in adults over 60, and it's also one of the most poorly explained. People get handed a number and sent home with almost no practical roadmap for what to actually do about it, starting today. That changes in the next few minutes. I'm going to walk you through 5 specific research-backed actions that can genuinely help support your kidney function, help bring creatinine trends back down over time, and protect your kidneys from further strain. I want to be upfront about what this video is and isn't. It is not a substitute for your doctor. It is not a miracle cure, and anyone who promises you one is lying. What this is a clear, calm, evidence-informed starting point, so that the next time you sit across from your physician, you're not a passenger in your own healthcare. You're a participant. You're asking sharp questions, and you already understand the why behind the answers. And if your numbers are significantly elevated, or you've already been referred to a kidney specialist, please treat this video as a companion to that care, not a replacement for it. Now, let's actually get into what that number means. What is creatinine actually telling you? Here's the short version of the biology. Every time your muscles contract, every step, every stretch, every ordinary movement of your day, they burn a compound called creatine, and the leftover waste product is creatinine. It never stops being produced. It just quietly enters your bloodstream hour after hour, day after day. Normally, your kidneys act like an incredibly efficient filtration plant. They pull that creatinine out of your blood and send it out. Through your urine, keeping your blood level steady, typically somewhere around 0.7 to 1.2 mg/dl for men, and 0.5 to 1.0 for women, though exact reference ranges shift slightly from lab to lab. So when that number creeps up, it's not really about the creatinine itself. Creatinine is just the messenger. What it's telling you is that your kidney's filtering rate, what doctors call GFR or glomerular filtration rate, has slowed down. The higher the creatinine climbs and the lower the GFR drops, the harder your kidneys are working to keep up, and the less efficiently they're succeeding. The obvious next question is why? And this matters enormously because different root causes call for genuinely different responses. Why this happens after 60. There are a handful of overlapping culprits behind rising creatinine in older adults, and understanding them is what makes the next section actually make sense, instead of feeling like a random list of rules. The first is simply aging. Kidney filtration capacity naturally declines by roughly 1% a year after your 40s. By your 70s, that can add up to a 25-30% drop from your peak. That's not a disease, it's biology, but it does mean the margin for additional stress gets thinner every year, which is exactly why the next 4 factors matter so much. The second is high blood pressure, and it's one of the most punishing forces your kidneys ever face. The kidneys are packed with microscopic filtering units called glomeruli, and they are built with extremely delicate, pressure-sensitive capillaries. Years of elevated blood pressure slowly stiffens and damages those tiny vessels, cutting off blood flow to the exact structures responsible for filtration. And cruelly, this becomes a two-way street. Damaged kidneys struggle to regulate blood pressure, and high blood pressure damages kidneys further. Each one feeds the other. The third is chronically elevated blood sugar, and this applies even if you've never been diagnosed as diabetic. When glucose sits high in your bloodstream for long stretches, it binds to proteins in blood vessel walls through a process called glycation, essentially stiffening and scarring the delicate capillary network inside your kidneys. This is quietly one of the leading drivers of kidney decline worldwide, and it often starts doing damage years before anyone gets an official diabetes diagnosis. The fourth is dehydration, and this one surprises people. As we age, our thirst signal becomes noticeably less reliable. Older adults can lose several percent of their body as water before they even feel thirsty. When you're dehydrated, your blood becomes more concentrated, blood flow to your kidneys drops, and creatinine rises, sometimes sharply. In a lot of cases, what looks like worsening kidney disease on paper is actually, in significant part, chronic mild dehydration in disguise. And the fifth is medication. Certain very common drugs, over-the-counter pain relievers like ibuprofen and naproxen, certain antibiotics, contrast dye used in CT scans, even some blood pressure medications at high doses can place direct stress on kidney tissue. To be clear, this is not a reason to stop taking anything on your own. It's a reason to have an informed conversation with your doctor, which we'll come back to. Why the timing of your action matters so much. Chronic kidney disease unfolds in stages, and here's the critical piece of information that almost nobody explains clearly. In the early and moderate stages, mild to moderately elevated creatinine, GFR still reasonably preserved, there's real, meaningful room for lifestyle and dietary changes to slow the decline, and in some cases even nudge function back in the right direction. Later on, once a large portion of kidney tissue has already been lost, the responsiveness to these same changes drops significantly, and care shifts toward managing complications. That's exactly why the window you're in right now, statistically, if you're watching this, probably early to moderate stage, is the highest leverage moment you'll get. Not a moment for panic, a moment for precision. So let's talk about precisely what to do, starting today. Action 1. Hydrate on purpose, not on instinct. Of everything on this list, this is the fastest to start, the cheapest to implement, and often the one that shows up fastest on your next blood panel. Your kidneys need adequate blood flow to filter properly, and blood flow is directly tied to hydration. Even mild dehydration thickens your blood slightly, reduces flow through the kidney's microvasculature, and lets creatinine build up because there isn't enough urine output to clear it efficiently. And remember what we covered earlier. As an older adult, your thirst mechanism lies to you. A younger person feels thirsty after losing about 1 to 2% of body water. Many older adults don't feel that same urge until they've lost 3 to 4%, meaning by the time you feel thirsty, you're already behind. Add in the common habit of deliberately limiting fluids to avoid extra bathroom trips, and you get a population that's chronically, invisibly underhydrated in a way that stresses the kidneys around the clock. The fix is to hydrate on a schedule, not a feeling. Most adults with mild to moderate creatinine elevation and normal urine output should aim for roughly 6 to 8 glasses of plain water a day, adjusted for your weight, the climate, your activity level, and of course, any fluid restriction your doctor has already given you. Dandelion root tea and nettle tea are gentle, kidney-friendly additions with mild diuretic properties. Water-rich foods, cucumber, celery, watermelon, zucchini, count too, and bring extra nutrients along with them. On the flip side, ease off heavy caffeine, which has a mild dehydrating effect, alcohol, which is both dehydrating and metabolically taxing on the kidneys, and sugary sodas or energy drinks, which dump extra glucose and phosphorus onto kidneys that are already working overtime. A simple way to start today, fill a 1.5-liter bottle each morning and treat finishing it by evening as non-negotiable. Set a phone reminder every couple of hours and check your urine color as your built-in gauge. Pale yellow means you're doing well, dark amber means you need more fluid now. Action 2. Rethink protein, especially red meat. This is the dietary change with the strongest, most consistent research behind it in early kidney disease, and it's also the one that trips people up most, because we live in an era obsessed with high protein eating for older adults. Here's the biology. When you eat protein, particularly animal protein, your body breaks it down into amino acids, and critically, nitrogen-containing waste, urea, uric acid, and yes, creatinine. All of that waste has to pass through your kidneys to be filtered out. The more protein you eat, the more nitrogen waste your kidneys have to process. For healthy kidneys, that's routine. For kidneys already running below full capacity, that extra filtration load can actually accelerate the decline you're trying to stop. Multiple clinical studies have found that moderately reducing protein intake, especially animal protein, slows the rate of GFR decline in people with reduced kidney function. In practical terms, most guidelines for adults with elevated creatinine suggest targeting somewhere around 0.6 to 0.8 grams of protein per kilogram of body weight per day, noticeably lower than the 1.2, 1.6 G often recommended for general older adult muscle health. For a 70 kiloliters, roughly 155 lb person, that works out to about 42 to 56 grams of protein a day. This isn't about eliminating protein, just being more intentional about how much and where it comes from. Plant-based proteins, lentils, tofu, chickpeas, eggs in moderation, tend to produce less nitrogen waste per gram than red meat, and are generally gentler on compromised kidneys. Fish and poultry in reasonable portions are a better choice than red meat. Red meat, processed meats, and oversized protein portions at a single sitting are the ones to actively pull back on. A simple starting point today, swap out red meat and processed meats from this week's meals and lean into lentil-based dishes, tofu or fish instead. Keep portions roughly palm-sized, and bring your specific protein target to your doctor or a renal dietitian, because the right number for you depends on your actual GFR, not a generic rule of thumb. Action 3, hunt down the hidden sodium. Sodium deserves its own spotlight because it drives a genuinely vicious cycle for the kidneys. When you eat a lot of sodium, your body retains water to keep your blood's sodium concentration balanced. That increases your blood volume. Increased blood volume raises your blood pressure. And as we already covered, elevated blood pressure is one of the most destructive things your kidneys can be exposed to over time. It damages the same delicate filtering structures that are already under strain. Once that filtering barrier is compromised, protein starts leaking into the urine, creatinine climbs further, and the whole cycle deepens. Most kidney-focused guidelines for adults over 60 with elevated creatinine recommend capping sodium at roughly 1,500 to 2,000 d/ml a day, about half a teaspoon of salt total. The tricky part isn't the salt shaker most people have already put away. It's the sodium hiding in packaged, canned, and restaurant food. A single serving of canned soup can carry 800 to 200 milliliters of sodium on its own. Bread, deli meats, cheese, sauces, and ready meals can quietly blow through your entire daily budget in one sitting. And even foods that don't taste salty, cereals, crackers, seasoning blends, often carry a surprising sodium load. The fix is developing a habit of reading labels, aiming for products under about 140 milliliters of sodium per 100 gram, where you can, cooking more from whole ingredients, and leaning on garlic, ginger, citrus, vinegar, and fresh herbs to build flavor without salt. Most people who commit to this see a measurable drop in blood pressure within just 2 to 4 weeks. And with it, real relief on the pressure their kidneys are carrying every single day. Today's step, check the sodium label on everything packaged in your kitchen this week. Swap canned soup for a homemade, low-sodium version, and start seasoning with lemon, cumin, turmeric, and fresh herbs instead of the shaker. Action 4. Treat blood sugar control as kidney protection, diabetic or not. Here's something that surprises a lot of people. Blood sugar management and kidney protection aren't two separate topics. Biologically, they're the same conversation. Even without a diabetes diagnosis, chronic blood sugar spikes from refined carbs, sugary drinks, and heavily processed meals gradually damage the kidney's microvasculature through that same glycation process we mentioned earlier. Sugar molecules binding to and stiffening the proteins in blood vessel walls. This damage doesn't announce itself. It builds quietly, often for years, well before anyone gets flagged as pre-diabetic or diabetic. In fact, research on people in the pre-diabetes range, which describes a striking share of adults over 60, shows kidney function. Markers can already be sliding during that in-between stage. Waiting for an official diabetes diagnosis before addressing blood sugar simply isn't a strategy that protects your kidneys in time. 3 shifts make the biggest difference here. First, swap refined carbohydrates. White bread, white rice, pastries, sugary. Cereal, for fiber-rich, complex carbs like vegetables, legumes, and whole grains, which slow glucose absorption and flatten out post-meal spikes. Second, spread your carbohydrate intake across smaller, more frequent meals rather than 1 or 2 large ones, which reduces the sharp glucose peaks that drive glycation. And third, this one is almost absurdly simple. Take a short walk after meals. Even 10 to 15 minutes of gentle movement after your largest meal helps your muscles actively pull glucose out of your bloodstream, meaningfully lowering the post-meal spike. If you're already on blood sugar medication, none of this replaces it. It works alongside it. If you're not, these changes alone can move both your HbA1c and your kidney markers over a matter of weeks to months. A place to start today. Swap tomorrow's breakfast toast for eggs and vegetables or plain yogurt with berries instead of sweetened cereal. Cut sugary drinks entirely. Take a short walk after your biggest meal. And if it's been a while, ask your doctor to check your HbA1c. Action 5. Do a full medication and supplement audit. This last one gets overlooked constantly, and it might be the most important of all 5, because it's the one that requires a conversation with your doctor rather than a decision you make alone. Your kidneys are the primary exit route for most medications. When kidney function drops, drugs that would normally clear T efficiently can build up to higher concentrations than intended, sometimes high enough to become directly toxic to the very kidney tissue trying to clear them. Burden on kidney cells regardless of buildup, triggering inflammation and oxidative stress in the tissue. The most common offender by far is the NSAID family, ibuprofen, naproxen, diclofenac, sold over the counter and used constantly for pain and inflammation. Often, NSAIDs interfere with prostaglandins, compounds your kidneys rely on to maintain their own internal blood flow. Without them, that blood supply gets compromised, especially if you're already a bit dehydrated or your baseline kidney function is reduced. In older adults with elevated creatinine, regular NSAID use can cause a surprisingly fast decline in kidney function. That conversation with your doctor should include asking whether something like acetaminophen or another non-nephrotoxic option could work in its place. But don't stop there. Certain antibiotic classes require dose adjustments with reduced kidney function. Contrast dye used for CT scans and angiograms needs your care team to know your creatinine level in advance. And this one catches people off guard. A number of herbal and natural supplements have documented kidney toxicity, including certain aristolockic acid MRI containing herbs, high-dose vitamin C, some Ayurvedic preparations, and products containing chromium or germanium. The bottom line, your doctor can only protect you from risks they know about. So today's task is simple. Write down every single thing you take. Prescriptions, over-the-counter drugs, vitamins, supplements, herbal remedies, all of it with doses and frequency. Bring that list to your next appointment and ask directly, given my kidney function, is anything on this list adding unnecessary strain? And one important caveat, never stop a prescribed medication on your own, even if you suspect it's part of the problem. That's a judgment call for your physician to make, weighing the risk of stopping against the risk of continuing. Why these 5 work better together than alone. Here's the piece that ties everything together. These 5 actions aren't a menu where you pick your favorite. Each one attacks a different pathway of kidney stress. Hydration improves blood flow, cutting back protein reduces the filtration workload, lowering sodium eases blood pressure and vessel strain, managing blood sugar protects the delicate capillaries directly, and reviewing medications removes hidden chemical burdens you might not even know you're carrying. When you stack 2 or 3 of these together, the benefits compound. Better blood flow plus lower blood pressure means those glomerular cells all at once. The research is clear that the combined effect of several of these changes together is meaningfully larger than any single one on its own. So don't overthink where to start. Hydration is usually the easiest entry point. Pick that up today and layer the others in as fast as feels realistic for your life. A simple way to think about what's on your plate. Rather than handing you a rigid meal plan, here's a mental filter that makes grocery shopping and restaurant ordering much simpler. Lean toward vegetables of nearly every kind, unless your doctor has specifically flagged high potassium for you. Leafy greens, cauliflower, cabbage, broccoli, bell peppers. Fruits like apples, berries, grapes, pears, and cherries tend to be lower in potassium and phosphorus. For protein, favor lentils, chickpeas, tofu, tempeh, egg whites, moderate whole eggs, and modest portions of fish or poultry. Olive oil, avocado, and walnuts are good fat choices in reasonable amounts, and whole grains like brown rice, oats, and barley fit well too. On the other side, pull back on red meat and processed meats, large amounts of dairy, canned and packaged foods loaded with sodium, sugary foods and drinks, and alcohol. A shortcut worth remembering. If it grew in the ground or swam in clean water, it's probably working with your kidneys. If it came out of a wrapper, a tin, or a fast food bag, it's probably working against them. Track the numbers, not just the symptoms. One of the most empowering things you can do alongside all of this is ask for regular follow-up testing, so you can actually watch your trajectory instead of guessing. Worth tracking over time with your doctor. Serum creatinine and calculated EGFR, the urine albumin to creatinine ratio, which flags protein leakage and is often an early warning. Sign, blood pressure at every visit, HbA1c if relevant, and electrolytes like potassium and phosphorus. Watching those numbers trend in the right direction over weeks and months isn't just clinically useful, it's genuinely motivating. Progress you can actually see on paper is progress you're far more likely to stick with. Work with your medical team, not around them. Everything covered here is meant to sit alongside your medical care, not replace it. If your creatinine is elevated, and especially if your EGFR has dropped under 60, a nephrologist, a kidney specialist, is genuinely worth having in your corner. A lot of primary care doctors only refer patients to nephrology once things have progressed significantly, so if you haven't been referred and your numbers concern you, it's completely reasonable to ask your doctor directly whether that referral makes sense. A renal dietitian is another resource that's massively underused. Kidney-friendly nutrition is genuinely complex, and your ideal protein, potassium, phosphorus, and fluid targets depend entirely on your specific numbers, not a one-size-fits-all chart. The real choice in front of you. There are really 2 paths from here. One is familiar. You get a concerning number, feel that jolt of anxiety, tuck the paperwork in a drawer, and quietly hope next time's results look different. A lot of people take that path, and for a lot of them, the next test doesn't bring the good news they were hoping for. The other path is the one where you hear the number, sit with it for a moment, and then decide calmly, deliberately, that you're going to do something with it. Drink more water, cut back on the salt, swap out the red meat, take a short walk after dinner, write down your medication list, and bring it to your next appointment. Give your kidneys the same quiet attention they've been giving you, uncomplaining, for every single year of your life so far. Your kidneys are remarkably resilient organs with real reserve capacity. And in the early and moderate stages, they genuinely respond to the right conditions. None of what we covered today is dramatic or expensive or complicated. Just consistent. And consistency applied over weeks and months is what actually rewrites the trajectory. You're not just a bystander watching this number on a page. You're the person with the most influence over what happens next. And now you have a real, actionable place to start. Not tomorrow, not after your next test. Today, with a glass of water, a note to call your doctor's office, and the decision that your kidneys deserve better than they've been getting.